All right, dentists, let's talk about something that I hear consistently causes a lot of frustration, a lot of venting, and frankly can derail an otherwise productive day. And that's hygiene exams. It seems like the moment you're finally in the groove, hitting that critical part of a complex procedure, or just about to pick up the handpiece for a focused block of work, inevitably, here comes the hygienist, needing an exam. Does that sound familiar to anyone? Many dentists feel like they're constantly being pulled in multiple directions, struggling to balance focused clinical work with the demands of hygiene checks. Some dentists thrive running 4 chairs of hygiene, while others feel completely overwhelmed with just 1. So what gives? How many exams are too many? And more importantly, how can you manage the hygiene exam flow so that it doesn't sabotage your productivity, your sanity, and your ability to deliver excellent care? Today, we're going to dissect this common challenge. We'll explore how to determine the right number of exams for your specific practice goals, discuss different scheduling models, and I'll give you some practical, actionable strategies to better manage the exams that you do have so that you can stay focused, productive, and ultimately build a more profitable and enjoyable practice. This is about taking control of your day and not letting the exams control you. So what is the right amount of exams for your schedule? The truth is, there's no magic number. The right amount of exams is the amount that allows you to consistently produce what you want to produce and achieve your practice goals. For a fee-for-service office where the doctor has a very high clinical skill set, they're attracting lots of patients with significant needs, and they can diagnose and close large cases, maybe 1 chair of hygiene exams is perfectly adequate. They're getting enough opportunities from that 1 chair. On the other hand, for a newer doctor, perhaps one who is still developing their diagnostic confidence, or isn't yet doing a lot of complex, high-value procedures, 3 chairs of hygiene exams might be necessary to generate enough treatment opportunities. You have to learn, adapt, and get good at efficiently handling the number of exams that your specific situation requires. There are some important ratios in dentistry to keep in mind here. As a general ballpark, and this can vary, a dentist needs to diagnose roughly $300,000 worth of treatment to actually produce $100,000. And from that $100,000 produced, they might take home, say, around $30,000. So as a very basic starting point, think about needing to diagnose about 10 times the amount that you personally want to make and take home. Of course, your individual skill set, your case acceptance rates, your fee structure, all of these will influence this ratio, but it's a decent average to shoot for. Now, some dentists look at the number like diagnosing $300,000 and think there's absolutely no way they could ever diagnose that much. And if your practice is primarily focused on basic fillings and single crowns, you might be right. However, imagine throwing in a steady stream of clear aligner cases, a good number of dental implants, a larger crown and bridge case, maybe some cosmetic work. As your clinical skill set grows, so does your ability to diagnose and confidently perform work that patients truly value and they're willing to invest in. So if you're not producing as much as you want, it's highly likely a result of this fundamental relationship. You're probably not diagnosing enough dentistry. And generally, the less complex or high-value procedures you're currently comfortable with, the more exams you're going to need to hit your production targets. So instead of immediately looking for ways to just change your model to get rid of hygiene exams, a primary focus should always be on continually improving your clinical skill set and your diagnostic abilities. This allows you to diagnose more comprehensive dentistry from the exams that you already have. What about just moving all the exams to a dedicated exam time so that you can work with uninterrupted focus? Can that even work? Some practice models do try this, perhaps having 1 doctor primarily doing exams while the other focuses on treatment. This tends to be more feasible in larger multi-doctor offices. It can be quite tricky to implement effectively with just 2 doctors, but with 3 or more and with excellent communication and flexibility among the doctors, it can work. I've seen it function well. However, a common challenge is that if 1 doctor is only doing clinical and no exams, they don't decrease their procedure times enough to fully offset the decreased productivity that comes from having those exam opportunities. For whatever reason, it just seems to be inherently more productive for most solo or smaller group practices for a dentist to integrate exams throughout their clinical working time. So if you're feeling the pressure of too many exams, what are some practical strategies? Well, strategy 1 would be to consider yearly exams. This is only a really good strategy if you genuinely have too many exams, you're consistently hitting or exceeding your production goals, and you can't manage your current hygiene load effectively, and you're not looking to hire an associate right now. Then transitioning stable low-risk patients to yearly recall exams instead of every 6 months is a viable option. This can dramatically reduce your hygiene exam volume. There are ways to implement this, perhaps alternating yearly exams with 6 months prophies with no doctor check, that they don't really hurt your overall production, especially if you're already very productive. However, let me be clear, if you are not easily producing at or above the levels that you want, then do not do this. While routine hygiene exams might not feel as immediately productive as, say, an emergency exam, a significant portion of your diagnosed treatment, often more than half, still comes from the hygiene department. Strategy number 2 is the 2-in-1 hygiene model. Another effective solution, especially if you have the demand for 3 hygienists, but not the exam capacity. Now, that's to structure your hygiene department with 2 chairs doing traditional prophy exam appointments and 1 hygiene chair that is dedicated to non-exam procedures. This 3rd chair could focus on things like scaling and root planing, SRPs or perio maintenance appointments, whitening procedures, and other services that don't require a doctor exam at every visit. This ratio often works well. You can even have hygienists rotate through this non-exam chair to prevent boredom and maintain their skills. This is arguably the best way to meet the hygiene demand of 3 chairs without being overwhelmed by the exam load of 3 chairs. You will, however, need to ensure the procedures in this non-exam column are scheduled efficiently and are productive enough to offset the lack of x-rays and exam revenue and still support the hygienist salary. Now, the 3rd strategy is the production block with a reduced exam load. A less commonly used but potentially effective option is to schedule 1 dedicated production block of, say, 2 to 3 hours each day, where you can focus on more complex or technique-sensitive procedures like endo, implants, or larger restorative cases. During this specific block of time, you could designate 1 or more of your hygiene chairs as no-exam chairs. Hygiene can continue to function, performing prophies or their services. You get a protected window of uninterrupted clinical focus. This can work really well to give you that deep work time without completely shutting down hygiene. Now, how can you better deal with the exams that you do have, regardless of the model? First, take ownership and control over your hygiene exams. Don't wait for your hygienist to hunt you down. Proactively go into the hygiene rooms and do the exams when you have a natural break. And work with your hygienist to develop a more flexible mindset where you can efficiently pop in at various points during the appointment and they don't feel the need to interrupt you at critical moments. Aim to batch your exams. Ideally, you should only get up to do a 1 round of exams once per hour, covering all that are ready. I have had hygienists where if I come in midway through an appointment to the exam, I can see it in their demeanor that they are annoyed or interrupted. You cannot let that exist. No matter when the doctor comes in, they need to drop what they are doing and happily greet the doctor and make the handoff. Anything less than this, and you need to talk with the hygienist and get that attitude corrected. Second, for emergency or doctor chair exams, set clear expectations. These unscheduled exams can be very disruptive if they're not handled well. One incredibly helpful tool is to carefully manage patient expectations. If you do a good job here, you'd be surprised at how productive you can be and how understanding patients are. It's important to always strive to be available for people who need help, even on short notice. If you already have your 2 primary doctor chairs and 2 hygiene chairs running, but you're constantly full and struggling to fit in last-minute emergencies or new patients, consider opening up a 3rd doctor chair and designating it as a work-in or overflow chair. This does require some mental flexibility from you and your team, and again, clear patient communication, but it can be a lifesaver. This requires some mental flexibility from you and your team, and again, clear patient communication, but it can be a lifesaver. Get an operatory, maybe put a TV in it. If your schedule is packed and someone calls with an emergency, you can put them in this chair. You'll let them know up front, our schedule is very full today, but we absolutely want to help you. We'll work you in as soon as Dr. Smith has a moment. It might be a 30-minute wait, but we promise that we will see and address your concerns as soon as we can. You could even compare it to an urgent care situation at a hospital. This is a concept patients are familiar with. You'll find that if you set these expectations appropriately and respectfully, most people are more than happy to wait a reasonable amount of time to be seen. Third, plan your day before it starts. Get to work a little early. Look at your entire schedule for the day. Visualize how it will flow. Mentally walk through your procedures and your exam times. Some dentists find it helpful to print out their schedule and literally map out or write down when they anticipate doing their hygiene exams throughout the day. Simply think through the logistics and knowing how you plan to approach things before the day's chaos begins. It can be a huge help in reducing stress and improving the flow. Now, fourth is establish clear, efficient exam protocols with your hygiene team. When you do go into a hygiene exam, it's critical to work seamlessly and efficiently with your hygienist. This ensures the exam is thorough, yet doesn't take too much time. It's a delicate balancing act. You need to connect with the patient, make them feel heard, and not rushed, all while performing a thorough exam. This takes practice and great communication. Your hygienists need to have all the diagnostic components of the appointment completed first thing. All necessary x-rays taken and properly mounted or rotated, perio charting updated and entered, intraoral photos of any areas of concern captured. All of this should ideally be done within the first 15 minutes of the appointment. This allows you the flexibility to come in for the exam at almost any point after that initial phase. Having these little things consistently done up front is critical for you to efficiently do your work during the exam. And finally, a crucial mindset tip: slow down to speed up. This might sound counterintuitive when you're feeling rushed by exams, but it makes a massive difference in both the quality of your exams and the amount of dentistry that you diagnose. Resist the urge to overly rush through things, especially the diagnostic process. I tell every dentist I mentor to spend time reviewing x-rays and patient charts in their private office, not trying to figure everything out for the first time in the operatory with the patient sitting there. When you're scrambling to interpret x-rays and formulate a plan while the patient is watching, you'll inevitably feel rushed. You're more likely to make mistakes or miss things, and you often project a lack of confidence, which patients pick up on. Instead, make it a habit to go through your upcoming hygiene patients' details, their x-rays, and their history in your office beforehand. Make your preliminary notes, jot down potential treatment options. Then when you walk into the operatory, you already have 90% of the clinical picture figured out. You can then focus your energy on connecting with the patient, listening to their concerns, reinforcing their positive habits, and providing a great overall experience, all while confidently presenting any necessary treatment. This slowing down of the pre-exam prep actually speeds up the in-room exam and significantly improves its quality and thoroughness. Managing hygiene exams effectively is a skill, and it's essential for a productive, low-stress dental practice. So if you're feeling overwhelmed by hygiene exams and want more strategies to run a smoother, more profitable, and more enjoyable practice, make sure that you hit the subscribe button. We tackle these real-world dental practice issues all the time. So take what you learned today about managing the flow of exams and start thinking about how you can implement these strategies in your own practice. Let's keep working together to make dentistry fun, fulfilling, and rewarding. Subscribe so you don't miss the next strategy, and I'll see you soon.